Okay, I think we're going to go ahead and get started. I just want to check my sound because my earbuds have been a little finicky today. Am I coming in loud and clear? Awesome, thank you so much. Okay, so hi everyone. Thank you for joining Zoom Room A for the data collection and enumeration session part 2. My name is Christine Kim and I'm the founder of My Dog is My Home. I'll be your moderator today. Before getting started, I'd like to share best viewing tips with the room. At the top right hand of the Zoom screen, select the grid icon that reads View for optimal viewing. During today's session, we recommend selecting Speaker View. I'm really excited to hear from our two presenters today, Dr. David Patterson from University of Tennessee and Sloan Haas from University of Denver, who will be speaking to different studies and different methods of data collection regarding the population of people experiencing homelessness with their companion animals. When My Dog is My Home first got started as a project back in 2012, there really wasn't much research about homelessness and animal companionship. When you looked at the academic literature, there were a handful of studies, most of them qualitative, that gave us a peek into the qualities of the relationship and bond between people experiencing homelessness and their animals. Quantitative studies that had larger sample sizes were very far and few between, and Dr. David Patterson, who's with us today, co-authored one of those studies, which My Dog is My Home still uses today as an example of how data can be collected on a community or municipal level. So we're extremely excited to have you here, Dr. Patterson. This research is particularly relevant now as New York City, my hometown where I live right now, the biggest city in the United States, has new laws that mandate record keeping and reporting on how many people experiencing homelessness have companion animals. Dr. Patterson is the Cooper-Herron Endowed Professor of Mental Health Research and Practice in the College of Social Work at University of Tennessee, Knoxville, as well as an adjunct professor at the UT Graduate School of Medicine. Dr. Patterson is the principal investigator and director of the federally and locally funded Knoxville Homeless Management Information System, a community outreach research endeavor of the College of Social Work. The primary teaching focus of Dr. Patterson's 31-year academic career has been on clinical social work practice. A major focus of his scholarship in recent years has been on homelessness and the application of information technology in service delivery for individuals and families experiencing homelessness. He is the author of Personal Computer Applications in the Social Services, Data Analysis with Spreadsheets, as well as numerous peer-reviewed journal articles and book chapters. Dr. Patterson, it is a pleasure to have you with us. Please feel free to begin when you are ready, and we will screen share your slides for you.
Okay, thank you very much, Christine, for that lovely introduction. I appreciate it. So welcome to all of you. Thank you for attending this session. As Christine indicated, I'll be talking about the 2009 study that we did on homeless people who are animal caregivers, and then I'll update that information. So next slide, please. So this work was done we published it in 2009. We'll talk about the frame of it. I just want to acknowledge my co-authors, Dr. Courtney Cronley, who was my PhD student at that time, is now an associate professor in the College of Social Work, and Dr. Elizabeth Strand, who was the person who developed veterinary social work. And she's completed her PhD and is at the University of Tennessee College of Veterinary Medicine and in the College of Social Work. And Sarah Gwaltney was an intern on this project. Next slide, please. So to put this in some context, and some of you, this may not be new information for many of you perhaps. In 1999, Congress funded the Housing and Urban Development, or HUD, to support communities to develop homeless management information systems. And the reason for that was, up until that time, across the country, people were largely collecting data either on paper or in spreadsheets, and the information was not shared among partners in the community. So the intention was to streamline data collection, enhance data collection accuracy, and facilitate the coordination of services, which is extremely important to people experiencing homelessness. We began our Knox HMIS system in 2004 as a cooperative endeavor between the College of Social Work, the UT College of Social Work, and our community partners. We see ourselves as the empirical window into homelessness for the city of Knoxville and Knox County. We began, and I need to give credit to Dr. Strand. She was the one who suggested perhaps that we ought to ask about animal caregiving among individuals and families experiencing homelessness, and whether people had refused housing secondary to animal caregiving. So we saw this as an opportunity to get more accurate information that would enable service providers to make more careful and considered decisions about the type of services they deliver. Next slide, please. So in 2009, we looked at the literature, and in 2009, we only found 4 articles addressing homeless individuals and their animals. 3 suggested that homeless individuals' attachments to their animals are stronger than those of the general population. Again, most of this is probably of no surprise to anyone in this audience. One study found that 61% of acutely and 93% of chronically homeless individuals with animals wish to find housing, but 96% of acutely and 93% of chronically homeless individuals said they would never live without their animals. Again, that speaks to the strength of the bond. I looked at the literature in preparation for this study. I did another quick look at the literature, and there really has been very little research done in this domain in the interim. However, Clary et al. Did an integrative review of the literature, finding 15 peer-reviewed articles addressing the impact of pet ownership on individuals. They concluded that the main advantages of companionship were a sense of responsibility and improved mental and emotional health, while any challenges were considered minor. And again, I think that is an important finding from that study. Challenges related to ownership mostly related to the person's desire to care for the animals and keep them, with few participants having relinquished their pets, with those having relinquished them experiencing profound regret about having relinquished their pets. Next slide, please. So in our study, in the 2009 study, we wanted to estimate the percentage of the homeless population caring for animals, because there had been no prior research on that. Assess the demographic differences between homeless people who are caring for pets and those who were not. Identify characteristics most associated with animal caregiving, and report on the percentages of homeless individuals refusing out of concern for their animals. So this was a non-probability I can never pronounce that term, purposive sampling of our homeless management information system. And essentially over we looked at data from a little more than 2 years, about 25 months. There had been 41, as you see, 4,100 individuals who were asked the question. I'm first going to talk about just the general sample, that 4,100 individuals, 39, the mean age was 39 years old. You can see that about 16% were under the age, or were between 16 and 24 years old. 41% were female, 59% male, and 226, and we'll get into a little bit more detail about this, 226 individuals, which was 5.5% of the sample, responded yes to the question. And of those who responded yes, 11 or 0.4% were under the age of 16, so they were youth. Next slide, please. So this is just a general descriptive statistics that allow you to see the general information on the population. or on the sample. We'll go to next slide. So I think this is more indicative, and this is the bivariate analysis. So looking at comparing the two variables at the same time. So with gender, male and female, what we found, looking at caretaking and non-caretaking, I've highlighted the things that I think are most important to pay attention to is that, again, 61% of the caretakers were females as opposed, and 39% were males, essentially 39%. And you see that that's almost an inverse of for non-caretaking. This is noteworthy as well that 82% of the caretakers were not married as opposed to 32% of the non-caretakers. Again, I want to point to homelessness, that 84% of the population of the caretaking said that they weren't homeless. And we'll talk about that. Or we speculated at the time that perhaps that was due to, as you see below, that 8% of the people who were responding as caretaking were fleeing domestic violence, and 18.1% were individuals who had permanent housing. So again, these are folks who likely recently lost their housing and were not describing themselves as homeless at the time of this survey. 18% of the individuals who were taking care of animals refused housing secondary to refused housing because of the caretaking. And the other thing I think that's worth noting is in ancillary services. So these were a chunk of these individuals, about 50% of them, were folks who were not necessarily seeking housing, but were seeking other services or assistance at the time that they were put into Knox HMIS. Next slide, please. So we then took all the variables and put them into a logistic regression to look at the relationship between the variables and the dependent variable animal caretaking. The model, as you see there, was statistically significant. What we found were that people who were Euro-American, married, or female were more likely to report current animal caregiving than their counterparts, non-Euro-American, unmarried, or male individuals. Individuals whose prior living situation was characterized by domestic violence, or that they lived on the street in permanent, or in permanent housing situations, were more likely than those previously living in emergency shelters to report animal caregiving. So we see relationship and living situation. And then first-time homeless individuals were more likely to report animal caregiving than those who describe themselves as chronically homeless. Next slide, please. So our discussion showed, we thought that the results of the study show that homeless persons who report caring for animals share certain characteristics. Those include individuals experiencing homelessness were more likely to report caregiving, were, as I described earlier, folks with these characteristics. That's an odd looking, the slide looks a little odd, but female, or Euro-American, married, and experiencing homelessness for the first time. Our findings suggest that organizations serving homeless individuals and families should use assessment tools to ask about animal caregiving. This was the first study to report on that. And training might be provided to staff members on how to provide accommodations and referrals for animal care that may improve transition into permanent and stable housing situations. So moving on to the next slide. So in preparation for this presentation, I asked our data geniuses to query our database between 2020 and 2021. Approximately this, so we examined, or we did a report that examined approximately 10,000 active clients. Of that 10,000, 436 reported yes to the question, do you currently have an animal you care for, which is approximately 4.36. And again, that approximate active clients, when I made the request, I didn't actually ask for the denominator. So I just asked on follow-up, and that's what I was told. The mean age was 42.4, which is higher than it was in the 2009 study. And there was a notable drop in domestic violence as a prior living situation from 8% to 0.23%. That's likely due to a change in the law that excluded domestic violence housing or providers from having to report to Knox HMIS. And so that's likely an artifact of a change in the law. Next slide, please. So again, we'll look at the prior living situation of this cohort, a place not meant for habitation. So these were primarily unhoused individuals living on the street who were caring for their animals and emergency shelter. And you can see again the very, very low rate of domestic violence situation. Next slide, please. And that's it. I would like to note Nate First, Deidre Ford, Chris, that should be Smith, Gary Motes, and Abby Winker, who are all on our Knox HMIS team, and thanks to Dr. Cronley and Dr. Strand. And this is my graduate research assistant, Willa. So that's it.
Thank you, Dr. Patterson. There are already some questions for you in the chat. So people are very curious about this work. I'm looking forward to diving into that Q&A after our next speaker. So as I mentioned earlier, a few major metropolitan areas in the US are now looking at ways to capture exactly this kind of data. This study was published in 2009, but it's as relevant as ever today. So thank you for talking with us about your work. As a reminder to folks, we do have that joint Q&A time with both of our presenters at the end of the session, so please drop your questions in the chat. All right, so next we have Sloan Haas from University of Denver, who will be speaking to us about participatory approaches to data collection and evaluation. As someone who has been advocating for greater services for people experiencing homelessness with animals, I often get asked about how many people are experiencing homelessness with their animals and how many people refuse to enter shelter or seek other kinds of services because their animals aren't allowed, and also how many this and how many that. So I've gotten fairly obsessed with being able to have a figure to share with people. And sometimes I have to be reminded that just because that's what program developers and funders might be asking, that's not the only thing that's important. So if we're concerned about social justice, we also need to be concerned with process and making sure those principles translate over into our research and how we gather that data. So with that, I'm very pleased to introduce Sloan Haas. Sloan Haas, she, her, is the Assistant Director of Research at the Institute for Human-Animal Connection at the University of Denver's Graduate School of Social Work. She manages a social science research agenda examining how animal welfare challenges intersect with human, social, and environmental justice issues. She earned her MSW and animal-assisted social work certificate from the University of Denver's Graduate School of Social Work and completed her undergraduate coursework at University of San Diego, receiving a BA in Ethnic Studies and Psychology. She also holds a certificate in animal shelter management from University of the Pacific. Her research interests include One Health, community-based participatory research methods, restorative justice, and community capacity building. Thank you for being with us, Sloan. I am really looking forward to your presentation. You will be sharing your own slides. Do you have the screen share ability down below in your Zoom toolbar?
Let's see, am I up?
We're not. Do you see the green button that says screen share screen?
Yep, I should know these things. We've been here in this virtual world for 2 years now. Thank you. It does say it's disabled for me still.
Okay, sorry about that.
I have it queued up. I can go ahead and share.
I made a couple updates, Dana, if that's okay.
Absolutely.
So, Dana, if you could
Do you want me to
share,
mhm.
or sure, if you can chat IKEA to maybe give Sloan the screen sharing rights, that would be great. And while we're waiting for IKEA to hop over into our room to fiddle with the tech, maybe we can address some of those questions that were dropped in the chat earlier for Dr. Patterson. So let's see here. We have a question from Vicky Ramirez from the One Health Clinic at Washington University, or the University of Washington. One Health Clinic from the University of Washington. She says, I was let in late to the room and didn't catch the source of the survey data. Did the survey tool only include sex versus gender?
I think that was the case at that time. We later changed that, but I think that was the case at that time. Yes.
Okay. Great, thank you. We also have a question from Sloan, and maybe this is a good chance for you to just go ahead and verbally ask, and there can be some interaction between our speakers.
Yeah, I was asking a similar question if there's been a move to change the data collection on sex to gender identity with kind of interest in LGBTQ plus individuals and homelessness. And then similarly, it looked like actually answered my question later in the slide, race, if that's broken out into specific groups or if it's just in that kind of binary. I think it's Euro-American versus non-Euro-American in the paper.
Yeah, that was in the paper. I think that we collapse categories. That the data we collect is more diverse, and we just collapse categories for the purpose of the analysis.
We have a question from Vicky. She asks if it seems like she's a fan of your slide deck, and she's wondering if you would be willing to share your slide deck. She says a lot of this information would really help. If she isn't tied into an academic institution, is there a way she can access the study from 2009?
Okay, those are two great questions. I can, here's what I'll do. I'll write myself a note to remember that I said this. I will put both the study and the slide deck in a Google Doc folder. And Sloan, while you're presenting, I'm going to do that, and then I'll put that folder link in the chat.
Wonderful.
And Christine, I'm happy to start like verbally if we're running short on time and I'm causing tech issues. Like my slides are helpful, but not like super essential.
I could also access an updated version via Dropbox if we continue to be delayed with tech help.
Yeah, yeah, that sounds good. Or we can just you can use that version that you have, Dana, and I can try to check.
Okay.
Anyways, yeah, so I can start verbally and then we'll just go from there. I'm cool to roll with it.
Okay.
But yeah, Dana, just stop me if I have access to sharing, or let's just go with this. This is totally fine.
Okay.
Cool. Okay, well, just thank you, Christine, for thoughts around kind of why this participatory method conversation matters within this broader context of the move to collect more data on this issue of housing security. I just wanted to start with saying I feel a little bit at odds with my values with a kind of a concurrent session happening right now being on individuals with lived experience sharing their stories, because that's a lot about that's a lot about what I'm about to get on my soapbox about here and talk to you all about. And so really my hope today is to add value in a way that kind of ties and amplifies what was shared this morning in the session around proximate leadership. And as Trap King says, hashtag same team. I want to talk about how folks like myself who are in a role really focused on data and research, how we can utilize some of those same constructs around valuing the voices of the individuals we serve in our evaluation and research processes. So next slide, please. Let's see. There we go. Cool. This is a little bit about the group I work with. We're the Institute for Human Animal Connection, or IHAC. We're based at the University of Denver, the Graduate School of Social Work, and we specialize in this field of human-animal environment interactions. And we have two areas of focus, one in education with a number of different certificates, both for Masters of Social Work students on our campus, as well as online professional development certificates. My area of focus is in our research, and we have two kind of buckets of work. We look at the impacts of animals and the environment on kind of therapeutic interactions, things like clinical engagement and vocational training. And then my area of focus is in our broader animals and communities research agenda, and that looks at really kind of what are the impacts of pets on community-wide health and public health outcomes. Next slide. The slide that I had right before this, which is a really important one, and it's, I think, telling that I omitted it, was a land acknowledgement. And so I just want to read that as that this is a really important piece of kind of that engaging in allyship and participatory work, is to understand the history of your institution and the relationship you have with the individuals you might be collecting data with and on. And so I'm going to read this real briefly. In the spirit of healing, I acknowledge and honor the Cheyenne and Arapaho tribes, the original people of the land upon which the University of Denver stands. It is with much gratitude that I recognize the descendant communities of the Northern Cheyenne tribe of Montana, the Northern Arapaho tribe of Wyoming, and the Southern Cheyenne and Arapaho tribes of Oklahoma. And remember that it is through their sacrifices that we are able to engage in learning and collaboration to further the study in higher education. And so I wanted to include that. What I have to share with you all today is around this idea of evidence-based practice. This is one of our core values as social workers, and something that it feels like the field is having, of co-sheltering is having this moment around. Dr. Patterson shared, this example of really kind of the only data we have out there in a really rigorous way about this issue of individuals experiencing homelessness and housing security and pet caregiving. And so we're at this place where evidence-based practice maybe needs to come into focus for our field. And so in general, this idea of evidence-based practice has kind of three areas that help you inform what is considered best practice. There's kind of the research, and then there's also what says in this diagram says clinical expertise, but that's really like you folks, like the folks doing this work every day, the practitioners. What have you identified as best practices? And then you also balance that, more importantly, I would argue here through this participatory framework we're going to talk about today, with your patient, your client, your communities that you serve, their values and preferences. And so I think at times as academics, we've really kind of touted this ivory tower mentality that like we are the knowers and the doers and the experts. And that has like been used to kind of guide where the field goes. And what I really value about My Dog is My Home is I think it's really elevating those voices of clinical, the practitioners, the folks doing this work every day, the blue area of the circle, and then increasingly with the storytelling aspect, the lived experience, that red aspect of the circle. So basically what I want to talk about today is plant this seed. Again, just kind of mirroring the language that Mary Lou shared this morning, like to be like bamboo here. Maybe you're not ready to hear this message yet, but maybe me talking about it now, a few years from now, it'll come up. And it's this idea that the research and the data that you collect is going to reflect your biases, both you as an individual, if you're the person designing the instruments, and also of your organization. And so that's important to recognize, and also that a way to combat that bias is potentially to include the voice of the folks that you serve. So if you go to the next slide for me, Dina. One bias that is pervasive in my field of social science research, and not so much in the field of social work, but just broadly around kind of people who do research, is this assumption about doing research with and on marginalized communities. The assumption is that they are difficult to engage and retain. So if we're trying to engage in more participatory research, there is a long laundry list of things that you might need to think through in terms of how you're going to kind of quote unquote overcome that barrier. And so there's a list of those on the slide here. They include lack of trust, poorly designed informed consent, scheduling conflicts, people not being able to take off work or having other things to do besides participate in research, the cost of participation, whether that be financial, again, taking that time off work, and then just in general that the procedures aren't accessible. They might be administered online and someone doesn't have access to the internet, or they might require transportation to get to the facility where the data is being collected. There might not be childcare available for them while they're hoping to participate, or the procedures are conducted in English only. And so just again, kind of planting this seed that historically the data we've collected has really ignored or exploited kind of the lived experience of the marginalized communities that we're doing research with or on. And we've really used it kind of for our own advancement, right? Like our careers have grown and exploded over the years. We've written a number of peer-reviewed publications, but they haven't always had impact on the programs and the policies and the people dealing with these experiences every day. And so kind of my call to action here, the seed I'm planting, is we have got to shift this dynamic in the data that we're collecting and how we're collecting it. And for me, participatory research is one of those guidelines. And so I want to share with you all the principles of community-based participatory research. This is kind of a formalized research method in the field that's used increasingly across public health. And I want to share a few examples or lessons learned, if you will, of how IHAC as a research organization doing research on a number of different human-animal interaction topics, including housing security, kind of what we've learned and that journey that we're on. Not to kind of say, hey, we're doing it right, but just to be like, hey, this is a process. It's really hard. And like the best thing you can do is get started. So that's kind of what we have in mind here. Next slide, please. So these are the four kind of basic tenets of community-based participatory research. You can swap research out for evaluation depending on what space you're operating in. I'm going to use the acronym CBPR just so I don't say those four words again and again and again here. The four tenets are focusing on relationships and coalition building, community-driven identification of issues, collaborating with the community throughout the research process, and then placing an emphasis on putting the research into action to affect change. So I just want to flag that I think 1, 3, and 4 are probably pretty doable, but number 2 is really tough because we as service providers, the lineage of my field in social work and the lineage of some folks who are in this animal welfare space has really been from this kind of white saviorism and desire to help. And so like kind of checking ourselves and all of the systems that are already in place and have been in place historically, with like kind of this preconceived notion of what the problems are, is going to require kind of some moving and shifting and shaking and unlearning, frankly, of all the things that we have thought is the right way to do things. And so just calling that one as attention of one from my perspective is really hard. Next slide, please. So the importance of CBPR, or just broadly more participatory research and evaluation process, these are just a few that come out from folks that are doing CBPR as a formal method in public health interventions, and then more broadly. When I think about like an image that reflects the research and the work that I hope to put out there in the world, it's this image. If you can't read the text, it says nothing about us without us is for us. And that's kind of, I think, at the heart of the CBPR framework. And it's this idea that as Mary Lou and Sterling and Dorothy shared this morning, like lived experience is expertise. And so if you look at kind of the way you collect data through that framework, you can develop more sustainable and effective interventions. There's a number of other benefits of CBPR, so it really helps us understand what is important to the community. It helps us kind of, this is a social worky phrase, meeting the community where they're at, and it improves our ability to discover the root causes of issues and create broader engagement of stakeholders, which is particularly important if you're engaging in some of this policy change. I just want to, like, as a side kind of commentary, like, there's a lot of emphasis right now, especially in the animal services space, but also in the human services space around this issue around access to care. And I think there's a reason that's what we're really focusing on. And it's because we've created all of these programs for people instead of with people. So we've built all of these systems that people don't have access to. That's why access to care is a problem. But if we had been building them with people all along, we wouldn't be kind of overcoming those tremendous barriers. I'm not kind of discounting the number of historical and like system-wide barriers that are consistent, like racism, like sexism, like those are all things, but just noting that, like, again, this kind of participatory frame to both evaluating your program, but also maybe even just developing your program from the get-go are really helpful ways to get to this place of having both effective and sustainable interventions. Next slide. So now I'm going to kind of pivot into some of these lessons that we've learned throughout our research. Again, some of these are housing security specific, but some of these are just more broadly across IHAC's research, looking at the impacts of human-animal interactions on historically marginalized communities. And this, in particular, we focus most of our research on communities in poverty and communities who lack access to pet support services. So the first lesson we've kind of been mulling around with is this idea of who should collect the data for our research and our evaluation processes. And so the CBPR principles that are guiding us through that work are number one, what it was number one and number three. And that's so focusing on the relationship and coalition building, and then involving the community in each step of the research process. For our latest kind of big 4-year study, we hired individuals from the communities who lived in the communities, who grew up in those communities, who spoke the languages of the individuals who live there, and we call them community-based research assistants. And one of the kind of sort of barriers, if you will, that folks ask us about a lot when we talk about hiring people from the community to do this really detailed research data collection is basically like, how did you find these people? Like, what skills and or training did they need? Were you able to find those people? And frankly, like, all of the skills are trainable. What really is not trainable is the people skills and that ability to relate. And like, that's not a skill you need to teach people when they're working in their own community. So that's just kind of, again, those seeds to let grow. You might not be ready to hear that information now, but basically what I look for when I hire these individuals is I need them to be bilingual, or at least speaking the language of the community that they're working in. We do provide some basic training on culturally sensitive research methods, but again, like, a lot of this is intuitive, and they actually guide us in deciding kind of how do we implement this research in their communities. And finally, we collect data door to door rather than relying on online sampling or secondary data, because we know there's some limitations to who reports to those different sources. Next slide, please. So this is an example of what that relationship, the focus on relationship building, looks like from a data collection perspective, and how we go about door-to-door data collection. Door-to-door implies literally you are boots on the ground in the community that you are doing research with. And so this is an example from our 4-year Pets for Life as One Health study. We had 4 study communities, and this is just one of them in the South Park neighborhood in Seattle, Washington. Shout out Vicki and all the great work that they're doing in Seattle. So this is a visual. So when we started this study, we kind of mapped the neighborhood and wanted to understand how many households potentially we were talking about being in contact with. There were 1,098 households that we mapped in the South Park neighborhood. So this is all those purple dots represent households. Next slide. And then what we did is we set up a sampling grid. So, we're ambitious, but we're not that ambitious. Basically, what we did is we randomly selected households that would be in our kind of sampling grid. And that was kind of randomly selected every other street. We kind of looked at generally how the houses were distributed. This is kind of nice where everything's in a grid, so it was really easy. But in a rural community where houses are spread out, sometimes it was kind of like an every other house, one house per mile type strategy here. So we selected 70% of the households. So that was a little bit over 1,000 households that would be kind of in our group of houses that we are hoping to recruit. Next slide. And then this is kind of the results of our efforts. This is, we did 4 years of data collection, and we were hoping to collect a survey from each individual in our sample every year. So the first year was 365 days of door-to-door knocking. We do 3 contact attempts, all at different times of day, different days of the week, so that we can accommodate folks who have different work schedules or kind of caregiving responsibilities. And we successfully contacted 542 of those households. So that was 70% of our sampling grid and 49% of the total households in the neighborhood. And so when we start talking about like representative sampling and some of this stuff that really matters to like the higher powers of academic research that be, this is what I mean when I say representative sample. I mean, I have real certainty that I have a fairly large group of people who live in the community I'm working with that are in my sample, and I know kind of geographically where they're spread out throughout the community. Next slide. So our next lesson is kind of in this bucket of like, well, what should we measure through this participatory frame? And the answer from the CBPR principles is involve the community in defining the issue. And so IHAC has kind of had 2 main examples of this so far. One around this issue of, or this topic of One Health. We've really worked with the communities to define the concept of One Health, and when they think about the health of themselves, their animals, and the environment around them, like how do they define that? And it turns out that accessibility of services is a common thread throughout that those 3 One Health triad areas. So we developed an instrument to measure One Health that we call the One Health Community Assessment through interviews with individuals who live in underserved communities. It's about 100 items, so it's very long. We're working on a short version for folks to be using more broadly. And they include questions in addition to just kind of broader perceptions and attitudes about health in their community. We have specific questions around accessibility. So for folks who care, it's a super reliable instrument so far with 4 years of use. Chromebooks Alpha is one indicator of reliability, and that one's coming out at over 0.9, with 0.8 being kind of the acceptable range. Next slide. Another example, I'm sorry, this is kind of building on the instrument. So one of the really interesting things that came out of kind of checking our assumptions as researchers and how we think about One Health is actually around defining access to care. In the field of animal services, there's been a big focus on kind of affordability of services, so providing low-cost services, free services. But it turns out there's multiple dimensions of access. They're here on the slide. There's availability, which really more or less means like, how soon can I get an appointment? There's accessibility, so like kind of where is the clinic located, like geographically? Accommodation, so like what are the hours of operation? Can I do a telehealth option? There's accommodation. So I'm sorry, I've got my order here in a mess. There's affordability, so other payment plans available, and then there's acceptability. So do they provide high quality or culturally responsive services? And there's also this really important distinction between people who have access to, like, yes, there are low cost options versus gaining access. And it's like, okay, well, but do the people who are living in poverty right now actually utilize those low cost services? So there's some interesting things coming out of including community members in defining these issues. Next slide. Another example of how we've kind of involved the community in defining this issue is asking clients how they experience the services and the programs that we're doing research on. And so one construct that we're interested in is looking at cultural competence, because we know that's a really important evidence-based practice for engaging historically marginalized populations. And so instead of just asking service providers to assess their level of cultural competence, we are increasingly also asking clients to assess their providers on their level of cultural competence, so that we can see, like, maybe this provider has done a lot of education on cultural competence and they feel really confident about their abilities, but then, you know, they go in and provide services to a diverse individual and it doesn't come across so good. So recognizing that having that community client perspective is really important. This is difficult, right? Like, usually we have more access to the service providers than we do to the actual clients, but that client perspective is really important in this participatory frame. Next slide. So our final lesson here is this idea of, like, how should we use all this data that we're collecting? And the CBPR principle is that we need to be putting that research into action. And so this is a housing specific example that we have going on right now. We actually just are in the middle of coding of the interviews. So y'all are first to hear some of these things I'm going to share. We've been doing a phenomenological study, which is a qualitative approach that really decenters our ideas as researchers about what the themes and experiences are of individuals experiencing housing security, and really centers their voices in developing the themes and kind of broader concepts that we're examining. So we did this focused phenomenological study in folks who live in affordable housing in Houston, Texas, in the US. And what we're finding is that individuals who are both trying to obtain affordable housing, so they might be experiencing homelessness or in some kind of transitional situation, and those who are currently in affordable housing, so they have secured it, but they want to have pets, or they currently have pets, that many of them are facing this impossible choice between whether they stay in secure housing or if they give up their pets. And so we're working on disseminating these findings through some non-traditional methods for academic research. So instead of just writing papers and calling it done, we're actually engaging in kind of town hall events with local policymakers and stakeholders, and including the people who participate in the interviews to share their own stories instead of me doing what I'm about to do, which is share those quotes without them present. We're hoping to invite them in, the folks who participate in this, who have lived experience in the issues they're studying, into the room with the stakeholders who can make change on the issues. Next slide. So here's a few findings, again, hot off the press, like we're literally in the process of analyzing these data right now, around how some of these things that we're finding about Houston tenants' experience in affordable housing, how we could put those things into action. So the first quote from participant A, I should say the photos here are not the individuals who provided the quotes. We have de-identified all this information, so I'm just providing photos as visuals, but these are not necessarily the individuals who, they are not the individuals who are saying the quotes here. So the first quote was, when I left Meatball behind, that was a heartbreaking thing. I had to choose to leave him. It's like choosing between life and death. And so this is a theme coming up already in the conference, but this need to acknowledge the value of the human-animal bond and how important that is to individuals. Next slide. Participant B shared this quote, I'd wait until everything was signed and say, oh, but wait, I got a prescription. You can't discriminate. And they're speaking to, when they say prescription, they're speaking to an emotional support animal. And so an action, again, a theme that's kind of coming up in the conference and we had sessions about yesterday, is this idea about emotional support animals and their ability to provide a sense of security, especially in a housing system that continues to kind of discriminate against companion animals and other forms of companionship with animals. Next slide. My last participant quote to share is participant C, and they said, I got accepted to the place and they're like, I mean, you're approved, but you have a pit bull. So, I mean, if you get rid of that pit bull, you can move in. And the action here is this need, again, coming up throughout the conference, to address breed, size, and or species restrictions, and especially have transparency about that issue. In this case, the participant was super excited to find a pet-friendly affordable housing property, but then went through the whole application process and came out to find that they discriminated against the specific type of dog that they had. And so then we're back on the search trying to find housing. Next slide, please. So in conclusion here, I hope some of these kind of lesson learned or examples were helpful. I'm happy to answer questions or provide more details in the Q&A. But I really just kind of wanted to, again, model that humility and that kind of frame that's really critical to doing participatory research. And it's that I am not the expert here. I see myself as a facilitator, as kind of like a congregator of conversation. I have some technical skills that allow me to kind of capture stories and narratives and put them out there through kind of these channels that help promote change, like academic publications. But I'm also learning and growing through this work, and this participatory frame feels very aligned with all of the issues that the field is talking about right now around wanting to take justice, equity, diversity, and inclusion into broader consideration. And so this is kind of my concluding thoughts around how we collect data with an equity mindset. But instead of giving you my thoughts about this, I wanted to leave you with some final reflection questions from a BIPOC nonprofit leader, Boulay, who runs an amazing blog called Nonprofit AF. If you're not following that one, it's a great read. And so some of these questions that Vu is advocating that we ask in our data collection process is the following. So how are the voices and opinions of the people most affected by this situation centered in your data? What power dynamics are involved in this issue? Who holds the most power in that situation? Who developed this system in the first place? Who benefits most from things remaining unchanged? Who is asking for change and who is defending against it? Who created the evidence that supports the status quo? What does the data say when we disaggregate it? So thanks for answering my questions about that, Dr. Patterson. And then finally, how does your identity, upbringing, culture, education, privileges, and biases affect your perspective? Next slide, just want to give a huge shout out to our partners on this work. Next slide. Also shout out to our funders, including Maddie's fund, who I know is on the call. And I think that's it. Next slide. Yeah, thanks so much.
Thank you so much, Sloan. That was really challenging and also super inspirational. When My Dog Is My Home got started, we had a much bigger focus on research because we thought that just like the academics and data collection part of things was super important. And as we continue to develop and try to do some of that research ourselves, we sort of put it down at a certain point because we were like, you know what, this group is not PhD types. Like we don't feel equipped to do this. And it's nice to hear that like there are other processes, other ways of collecting data that have more to do with facilitation and involving community. And obviously there would still need to be a partnership with other folks who can make sure we're still being rigorous, although I do have questions about that hopefully we'll get to during the Q&A. And so thank you so much, Sloan. That was really a wonderful presentation, and I'm sure people have a lot of things that they want to ask you. So we will open up the Q&A now, and that includes Q&A between speakers as well. And to begin, I am going to pop back into the chat and scroll back up to a lot of questions that we didn't get to answer for Dr. Patterson. The chat went crazy for you, Dr. Patterson. I think people are really excited about this article that they may not have realized was there. So I'm going to revisit some of this. So from Jennifer, she says, this was fantastic. Is there any similar data available on an open data platform where individuals can query and analyze the data and trends themselves?
Yeah, I think that's a great question, and not to my knowledge. I don't know that anybody has put these data in the public domain. Part of it is, yeah, I don't think part of it is just making sure it's all de-identified and that there's IRB approval for doing that sort of thing as we tread through academic circles. But I think that's certainly possible. And I think the question would be whose data and from where and how and what questions do you have? I mean, what I mean by that is data from Knoxville, Tennessee may not be as informative as data from a local area. And also, just not to go on ad nauseum, it might be helpful to have that conversation with your local HMIS, because HMISs exist around the country, and to enter into a partnership with them.
Yes, thank you so much for saying that, Dr. Patterson. That leads me into a question that I have for you. So there is some effort in different places to figure out how to do this on a very large scale. How do we capture this data on how many people experiencing homelessness with animals? And people have been talking about the point in time count that happens annually, and using that as a method for surveying, or like being able to count and enumerate how many people are out there with companion animals. That is certainly an interesting method, but I feel like you're really capturing two different kinds of data. Like HMIS is capturing something and the pit count is capturing something. And so could you describe to us sort of the differences between these two tools and what each one is capturing and maybe what some of the limitations are with both sets of data?
Oh, well, great question. Do you have another one? All right, so the point in time count is an intention. The intention there is, and these are done across the country. They're an expectation by HUD for COCs, and essentially there are a set of. I think there's some set questions. We just finished, or we're in the midst of our pit count right now, and there's a set of questions that are HUD questions, and then sometimes there are community questions. There is an attempt to do street outreach to reach the folks who are in camps and who are living, as the Brits say, living rough, and those who are in emergency shelters and other settings. And so what you get there is in some ways, a sample of convenience, that you get data on the people who will talk to you and who are available. HMIS systems, I can speak most clearly to our HMIS system. We see ourselves as a supra agency that connects all of our homeless service providers into a secure database. And we collect a wide variety of data about that is both demographics and service delivery and outcomes. And when I say we, I mean our respective agencies, their programs, and the case managers in those programs who are actually doing boots on the ground data collection. So to put that in some context, I mean, in any 1 year we have, and again, we're a small community, we have data on over 9,000 individuals, as opposed to a point in time count that may capture data on in our community 200 to 300 people. So it's an issue of what data are you collecting, and how is the data being, this sample of convenience and bit data versus HMIS data, which is service delivery demographic data captured over the course of the year.
Is it fair for me to say that HMIS data is more comprehensive in that, like, the pit count data is, a snapshot in time. It's one time of the year. In New York City, it happens from midnight to 4 a.m. in January. And so you're really getting, a certain type of homelessness, and that's all, those are the people you're surveying. And HMIS is really for everyone who comes in contact with homeless services. Is that correct?
Yes, and the only caveat I would have is everyone who comes in contact with homeless services who consent, at least for us, consents to have their data put into the system. And I add one other thing, is that homeless service provider or HMIS systems vary across locales and states. And again, this goes back to community-based research. We were really intentional in forming our partnership with our community of convincing all of our providers for there to be a transparent HMIS where data with the client's consent can be shared amongst the homeless service providers, as opposed to this collected in silos. And that was a intentional effort of community engagement. I just wanted to nod to Sloan on that.
I have a follow-up question, Dr. Patterson, about that. I was curious if how did that go? Like, were folks really willing to sign that consent? Like, what did you hear on the ground about that process?
Yeah, we have very few. So you're talking about consent to have their data put in the system. We have very few people who refuse. That happens on occasion, and that's fine. But we have a pretty clear consent form. And what it has within that consent form, that they're consenting to have their de-identified data used in research. So we don't get, to the best of my knowledge, we don't get a lot of rejections.
Yes, and I do want to also point out something else you said that's really important. So it's local, like your HMIS system in Knoxville is different from the HMIS system in Los Angeles and everywhere else in the country. And I think it's surprising for advocates to learn how much is controlled locally about like what kinds of questions are asked. And that also goes for the point in time count. And so like your local community, your continuum of care or your government, or the universities in your local area, they're the ones who are determining what gets asked through these tools. And so like having those local connections, is that not true? No?
Well, largely they are asking questions that there is a set of universal data elements that's established by HUD, and there's no variance there. Our community added some questions, for instance, these animal companion questions, but largely they're questions that are either universal data elements of HUD and then specific questions of the program or the agency. But there's a lot of uniformity, at least in our HMIS.
Yes, thank you for that clarification. So locally, questions can be added, and there's some local control there on top of what is standardized. So that's great to know. I hope that information is useful to folks who are looking at different ways of, enumerating or somehow collecting data on this population in their communities. So Sloan, I have a question for you. Like all research, I imagine participatory research that is not done carefully has the potential to do harm. For people or organizations interested in exploring participatory research, what guidance can you give them to make sure they are protecting the communities with which they are attempting to partner?
I'm not going to pass on this question. I like how you phrase Dr. Patterson. Next question. No, I think this is the question. So thank you for asking it. As I stated, like I'm very early in my sort of academic journey. I've been in this role for 5 years. And I was doing community organizing before I did research. So like my training is like real-time training in research. I'm learning as I do the research. I don't have a PhD or have any of that kind of formal stuff. So I relate to where my dog in my home was in their learning about whether research is kind of their path. And that being said, I think the part of why I think I love research now, I didn't love it then because I didn't know that this was possible, but is, basically I see research as like storytelling, as just like capturing stories, and as building relationships and like kind of building trust and earning trust and kind of putting those stories out that aren't told in this like kind of more broadly, I wouldn't say accessible because, as we noted, like even Dr. Patterson's amazing seminal project is like hard to access, right? He's got to upload it into a Google Drive and drop it in the chat in a conference for people to get access to it. So, we haven't protected that, but that was kind of the basic idea. So that's just in general research. For me, when you add this participatory lens, the opportunity to create harm is greater, but also the opportunity to repair harm is also greater. And so I try to hold those two things in my head at the same time, like that I have Spider-Man, like great power, but also great responsibility, right? And that's kind of how I'm engaging in the work is, again, like engaging more from that cultural humility framework, like as a listener and a learner, and as somebody here to like kind of capture the stories and not to say like, this is right, this is wrong, this is important, this is not important, and just like let the folks that we're doing the research with like kind of guide us. So I don't know, that's kind of where I'm at in my thinking about this. But, I'm also doing a lot of work every day of just like doing the stuff like that I need to do to understand what my biases are in this research and kind of how I show up when I conduct it so that like my stuff does it impact like what I put out there in the world? So that's kind of why I started with that. Like, this is the seed. We might not be ready to hear it right now, but like our bias is going to inform the data we collect no matter how hard we try. And so like, you know, there's these like CBPR is a field, like it's a method, you can follow the steps, you can do it, but like that doesn't mean you're going to do great work just because you're doing CBPR. You still have to like do the rest of the work on the individual level and as an organization and as a like good stakeholder. So those are kind of my current thoughts about that. But yeah, it's a journey. So I'll keep sharing as I learn and hope that you all will join me and share with me what you're learning.
Oh, amazing. I think people would definitely take you up on that invitation. Okay, so back to Dr. Patterson. Do you think the data around the percentage of people who refused housing options due to prohibition of pets is representative of a national average, or is there something unique about Tennessee Knox County that might affect that number?
Yeah, I think that's hard to say. We have one low barrier shelter that accepts pets now. And I think that that's been in place for about a year. I would not, I don't know. I'm going to throw up my hands. I have no idea. I think it's a great question, and it's a great reason to go back to graduate school and get a PhD and pursue that question for everybody. I honestly don't know. I think that's an open question. I don't think there's anything unique or terribly different about Knoxville. So perhaps.
It's definitely unique that Knoxville bothers to collect this data. So it's hard to say if there aren't other places that are also collecting this data, right? Like there's nothing to really compare it to. All right, so we have a question from Marissa Geyser. I would like to hear more about the notable drop in domestic violence. Are there any explanations behind this drop?
Yeah, I touched upon that and probably went through that pretty fast. When we were collecting the information the data collection stopped in 2007, and we published in 2009. At that time, there were not very many specific domestic violence programs, and domestic violence programs at that time were reporting to or adding data to the HMIS. And then there was federal law that said, hey, you don't have to do that. And so I think the drop that you see is simply a matter of change in the law. I don't think that, I wish that there was a dramatic drop in domestic violence, but I don't think that that's the case.
Okay, thank you. We have time for one last question, and this one goes to Sloan. Sorry to give you only 3 minutes to answer this one because it's a big one. And I'm sorry, you know, if I as a non-academic person, not affiliated with a research university, I don't know if this is going to come off sort of ignorant or, but there's a question of rigor with participatory research is like, how do you do your research with the community, hire folks from the community, and ensure that it's rigorous as well?
Yeah, I always tell my students and myself, there's no stupid questions, there's only stupid answers. So I hope I don't give you a stupid answer. Yeah, I think that's a big question, especially when I'm talking about like getting funding for a CBPR research project. Thankfully, there are lots of very large agencies, especially in the public health space. For example, Robert Wood Johnson Foundation, who pretty much exclusively fund, like they might not call it CBPR, but they are participatory research studies, like they nudge you in that direction. I'm seeing more and more of our animal welfare funders also kind of nudging us in that direction. So thankfully, I don't feel like I'm having that specific conversation as much. But like, I think Danny dropped a question in the chat around like the cost of doing stipends for community-based researchers, and kind of, it's expensive to do community-based research, right? Like I shared, like we did 365 days of the door-to-door data collection, and like that was to collect, about a little over 1,000 surveys. And that data is powerful because of, all the design considerations that we put into place. So I guess what I would say is that we put a lot of intention into like all of the steps of the research process, from identifying the issue to, designing our instrumentation and our kind of site selection. Like, so we're still doing rigorous research because we're checking all those boxes of what quote unquote rigorous research consists of. And that's like validated instrumentation if it exists. We use fancy statistical methods like phenomenological qualitative approaches. And, we do all kinds of fun regressions in SPSS and R. So like the rigor is there. It's more of just like who's providing the data and what type of data are we asking for that we are really focusing on involving community members on. And so honestly, like it's a pretty open field right now for us because there's not a ton of participatory oriented stuff in the animal welfare space right now. So we can pretty much, like the level of rigor, I guess I would say, is not very high. So I challenge everyone here to just like keep raising that bar. Like again, would love to see more folks doing some of this participatory work so that we can like almost, keep raising those standards and holding each other accountable to be more participatory. So right now it's basically like, oh, cool, I did something that was participatory in nature, and that